So, Namaskar everyone. My name is Dr. Manish Yadav and welcome to my channel. And we are in the series of understanding burnout. Now we have jumped from tumors of burnout to a book where he has a wonderful book which he wrote. It's called Disease of Spleen. You can watch this. I will be putting the photograph of that book and it is easily available. And diseases of spleen, the organ affected in the body spleen, and which are the remedies which organopathically we can use for our patients so that we can help them in their grave pathological conditions. So before you watch this video, here we're going to talk about organopathy and we're going to talk about certain drugs which are used like single drug, one drug I'm going to specifically talk about. But before we watch this video, I will urge that before this, I have made a small talk on spleen, the pathophysiology of spleen. It is very crucial before you understand an organopathic drugs, you have to go and understand the organ, okay, the pathophysiology of. So it's a short video, maybe 8-9 minutes video. It would be good if you can brush it up, your knowledge. It is just brushing up, not much details of it. And directly then you come to this talk. So let's begin with this talk. And in this talk, I'm going to specifically talk about one drug which really talks about, Burnett talks a lot about this drug, which he has used in many cases of organopathically using in a spleen disorders, and how he has used and how we can use it clinically so that we can help a lot of our patients. Before I talk about this one drug, I'm going to talk a little bit about organopathy. So let me just take you to my slide and we'll start speaking about organopathic drugs. I've already spoken about organopathy, its understanding of it, and people who have gone through my other lectures, they must be knowing exactly what we're going to talk about. But I'm just going to talk about a little bit more about organopathy, what it is, and what it does really mean, and what was actually the idea of Burnett, what the way he used to think about organopathic drugs. That is very important. So organopathy means, in simple, it acts on organ, specific sphere of action. Okay. And especially this entire term of organopathy was coined by Burnett himself. Burnett, in his Disease of Spleen, writes down that this organopathy, though he has coined this term, or in his era, this term got coined organopathy, but actually honor the credit of this entire system of organopathic drugs understanding is due to somebody. It is not to Burnett. He says it is not to me. It is due to Paracelsus. The honor is actually due. People have not understood, maybe, or not given that actual due or credit to Paracelsus. So whatever we are understanding today, the origin of it started with Paracelsus. And after Paracelsus, Rademacher, who was actually known as modern father of organopathy. So Paracelsus was the person who first introduced that, you have to give a similar remedy to a similar disease, right? Sameness, not similar exactly, but same. He used to say same, like, like and like. And after that, Rademacher took this science and from there he went. Now listen to this very carefully. A strength of a chain is equal to its weakest link. Suppose you're wearing a chain, a gold chain, or any chain you are wearing, and you pull it, right? Stretch it. The strength of it, it depends on the weakest link. The link which is weak, if there's one link which is weak, the strength of entire chain is going to come. So value of person's life may be equal to the weakest organ. So what is the value of a life? A weakest organ means a person can be healthier from all the sides. But if one organ is weak enough, the whole organ, the whole individual person can be weak. Here, a particular organ is equal in importance to an entire organism. For example, somebody is having a weakness of heart. Other parameters are absolutely great, 10 on 10. But his heart is weak. That weak heart, if not taken care properly, can take his life, though his other organs are strong enough. Same thing is with other organs like prostate, kidney, liver, right? Even the systems like nervous system, hematology, the blood system, any organ or system which is weak enough, the entire organism is weak in that regards. The weakest organ is as important as the entire organs. And that's what we have to understand. In homeopathy, sometimes we don't look at the organs. We don't think like an allopath. We don't look at the pathophysiology. We don't look at the clinical reports. So along with our individualized treatment, constitutional treatment, it is very important to understand which organ is under pressure, which organ is ready to give up, or it's getting weaker and weaker. Because the entire organism strength depends on the weakest organ. Affected organ need to be taken into consideration. It's very crucial when you're handling a disease, especially chronic disease. It is very important. And if it is a pathophysiological, pathological disease or cases, affected organ has to be taken into consideration. Hence, the role of organopathic drugs comes into picture. And that's how, with this understanding, this was the mindset, this was the understanding of Burnett. And with this mindset, organopathic drugs now comes into picture. Damaged, weak, or diseased organ aids with our remedy. And this is the most beautiful thing. The damaged, weak, or diseased, the problematic organs can be helped with our medicines. We have got some great medicines. Maybe those are rare medicines, rare in the sense because we have not much literature about them. We know few things about them, but people have definitely discussed and talked about it. Clark, Burnett, Borick, so many other books like Hughes. They have discussed about it. Clinical evidences are available. Toxicological data are available. We have to understand those remedies in those terms, and then we can definitely help these organs. Now listen to this carefully, even when a tissue state of an entire organism is everywhere equally bad, it may be life-saving act to relieve a particular organ that first gives up. Suppose you get a patient where liver is affected, spleen is affected, prostate is affected, some other system is affected. You have to look into the case, and he says that specifically look at the organ which is just about to give up. That is like, other are bad by 10:2, but this is 10:8, it is bad. It is just about to give up. So he says it could be life-saving. Forget other organs. Look at that organ and help him with the remedies. So that time may be gained to alter the entire crisis or quality of stroke. It's like, you're being attacked from all sides. There are some fronts which are weak, there are some fronts which are very strong. Like, they are getting disease, they're getting, bogged down, but they are fighting. But you find one area which is very weak, that it is just going to give up. What do? You take your entire resources and just save that. Because till then it is saved. You have at least time for the other areas. Then you can go to the other areas, and in this process, you can really help and get the patient a great help, especially in dying condition or pathological conditions. Death itself is often it starts in a particular organ. He says very nicely, how does death come? It starts in a local organ. An organ at the tissue level starts dying, and slowly the entire organism dies. And if the part is saved, if a part is saved in time, life may be preserved. So if you really want to preserve a life, you have to really look into the organs. Okay, you have to look and save the parts. In acute processes, the value of particular organ strikes one often very forcibly. Like in acutes, we're talking about chronic pathological condition, but in acute, definitely its organ important is there. There may be no need in constitutional treatment, as the one suffering part may be the whole case. That's a different story altogether. Like in a constitutional, when you're trying to find out, maybe you don't need to consider all the organs, because if you get a remedy which is acting at different levels, at deeper level, it can take the care of entire organ. But in acute disease, you need to find out a remedy which has specific action on the location. He goes ahead and says, in many chronic cases, certain organs claim and must have special attention. You have to look into those. So what is organopathy? Organopathy is homeopathy in the first degree. It is not different. In fact, homeopathy equals to organopathy plus something else. What is something else? Your aggravation, amelioration, modalities, concomitants, mental, generals, and one part is your organopathy. Now, something very important and cautious for all the people who are trying to understand organopathic drugs. This is what Burnett says. It's so important. Where homeopathic similimum agent covering the totality of symptoms and also the underlying pathological process causing such symptoms can be found. Listen it carefully. People always feel that Burnett was a very specific prescriber. He always kept on giving specific remedy. Now listen what he's saying. When you read his literatures, you find out that it seems that he was against totality of symptoms, but it is not exactly like. See what he writes. He says, when you come to a condition where homeopathic similimum agent covering the totality of symptom and also the underlying pathological process causing such symptom can be found. If you find that remedy which covers totality and the pathological process, their organopathy has no reason for existence. Remember this. Or it is of only temporary service to ease an organ in distress. Who's writing this? Burnett, who's understood like being a specific prescriber. So he says that in a condition when you can find a good totality, you can find the remedy acting on the pathological process, no organopathic remedy needed. There's no need. Okay. So with this idea, now we jump to a very wonderful remedy called CEANOTHUS Americanus. There's one more remedy called CEANOTHUS. It is for CHEA. Don't mix it up. It is CEANOTHUS, CEA, CA. I remember this as a CA, like raw CA, CA. CEANOTHUS Americanus. It's a wonderful spleen remedy. And let us understand this drug. I have said this in many of my talks that understanding the organopathic remedies, sometimes people say that, okay, kidney, these are the remedies. Liver, these are the remedies. Okay, but you cannot prescribe even the organopathic remedy or mother tinctures unless you understand the cardinal symptoms of those remedies. So even at the level of giving mother tinctures, you have to individualize and give it. For that, it is crucial for us to understand the drug at all levels. This is how the plant looks, CEANOTHUS. What is it called? It's called New Jersey tea red root. Botanical description, let's understand. So CEANOTHUS is a small shrub growing from 3 to 4 feet from dark red root, which varies widely. During the Revolutionary War, when the Revolutionary War was going on, leaves were used as a substitute for tea. That's why it is called New Jersey tea. What are the constituents and medical uses? Before homeopathic uses, how it has been used and what are the constituents of it, medicinal. Red root or the root of bark of New Jersey tea are used by Native Americans in North America for infection of upper respiratory tract. The leaves have fresh scent of wintergreen and were later used by the European colonizers as a tea substitute or stimulating caffeine-free beverages. So it is being used as a tea. Root bark of the plant is used by herbalists today and are used notably remedies for lymph system, for the problems of lymph system. So herbalists, they use this remedy for lymph system. If there's a problem with the lymphatic circulation or, immunity, for an immunity booster or something like that. The root contains astringent tannins and number of peptide alkaloids, including ceanothin, A, pendamine, zizipine, sutinine, and other few of them. Mind you, they also have mild hypotensive effect. Red root and the flower extracts can be used as a dye. Now, when you look at this slide, this talks about the entire sphere of action. CEANOTHUS, as we know, we just know that it is a spleen remedy. Anything happens to spleen, you can give CEANOTHUS. But knowing this thing, give you an understanding that CEANOTHUS, the disease will not just produce like this. There will be an evolution of the disease is always there. In every remedy, when you read the remedy from evolution cycle, you will understand that in the entire history of the patient, these could be the system affected. So it is a remedy, not just for the spleen. It is a remedy for patient who might have upper respiratory tract infection, who might have lymph system defects, and also moreover hypotensive effect means the blood pressure falls down. So it could be a very good remedy to push it up. Like, we get a lot of hypotensive, especially ladies. We can help them. So this is the entire range of sphere of action of CEANOTHUS. Toxicology. Let's try and this one. Roots. It causes infection of upper respiratory tract. Problems of lymph system. What you need to do is that we need to go and see what are the diseases that affect lymph system. So all the problems of lymph system, and we have earlier slide we studied that herbalists use as a lymph system remedy as a immunity boost. Mild hypotensive. And so these are the toxicological data: infection, upper respiratory tract, lymph system, and hypotension. So in a CEANOTHUS patient, where you don't want to give it empirically on giving on indication, you will find that in the past history, you will have something to do with pneumonia, bronchitis, upper respiratory tract infection, something to do with lungs or the respiratory tract, especially upper, not lungs, not lower, I'm sorry, but upper respiratory tract means bronchitis, throat affections, inflammation, tonsils. These are the things which you will see, mostly upper respiratory tract infection. Lymph system problem will be there, all the diseases that we spoke in the last lecture, and also there could be a trace of hypotension. Miasmatically, if you want to understand, it says effective in syphilis and gonorrhea. So in the patients, you will find out syphilitic disposition of gonorrhea. Now let's go to some great authors and what they talk about. Clark Clinical. When you open Clark Clinical, he writes diarrhea, heart disorders. Now, CEANOTHUS, before studying this, I could never think of CEANOTHUS in a heart disorder. I said, how is it possible to give it in heart disorder? I've never heard. But you will go back, and I hope you must have seen somewhere here. It was used for a heart disease. Okay, somewhere. Where is it? Where is it? Okay. Just a minute. Just missed that point, but somewhere it is written that it's a very good remedy, something to do with heart. Maybe it will come ahead. So diarrhea, heart disorders, intermittent fever. Just look at the clinicals. Many times we don't look at the clinical. We say, this is just the diseases effect, nosology. No, it is very important. Look at this: jaundice, leukorrhea, menses suppressed. Now, can you imagine? Now, when I was reading CEANOTHUS, I said, for leukorrhea, I have never heard about anybody using CEANOTHUS and looking into leukorrhea symptoms and giving CEANOTHUS. That's so different, right? That's what I say. Every remedy, mother tincture that you use, organopathic drugs that you use, it also has got its own mater medica. It's individualizing symptom. So you will find these disorders in the patient. Diarrhea, you will see support from diarrhea, heart disorders, intermittent fever like malaria, jaundice, liver is affected along with spleen, and leukorrhea will qualify the symptom later on. Menses suppressed, and the most important, side pain. This is the very important symptom, which when we go ahead, we will get to understand that how you can find out that this patient is having spleen affection or he needs CEANOTHUS is side pain. Patient will always try to show that he has got side pain. Spleen affections. With all the disorders, you will have spleen affections always there as a concomitant. And the most crucial, I feel the most important is leukocytemia. You will find in the patient that WBC count is raised. So many times we see some patients where WBC is raised, WBC is raised, they are prone to infections, continuous infections happening, and WBC count is always raised, always raised, always raised. Yes, when the spleen gets enlarged, it's very easy to prescribe CEANOTHUS. But before it gets enlarged, and it's been working out more and more, don't you think it is better to catch hold of it before the things go worst? If you have this understanding, then definitely you can think. So now in those cases, how do I think? Now I think in those cases where WBC count is continuously high, he's prone to infections, he's getting different types of infections. So what is spleen doing? Whenever infection happens, spleen is overworked. WBC counts are increasing. It has to kill more WBCs, and it has to kill more red blood cells, but yet it has to produce more WBCs. It has to kill more bacteria and viruses. So when infection increases, it will kill all the infective agents like bacteria and viruses and excessively produce spleen. So whenever WBC count is raised in your blood, the production mechanism happens. The production happens per house, and the storehouse and the production house is your spleen. Spleen is at overwork. This is how clinically you have to think. So leukocytemia is a very important component to give you an indication towards spleen remedy, and especially CEANOTHUS. Boric repertoire. Now I am in love with boric repertoire because generally I'm a repertoire prescriber. Okay, I learned a lot of remedies, but I want to know how I can use rubrics basically. And to increase the knowledge of rubric, whenever I read a remedy, I always go back and read Boric's repertoire, reverse it. So what are the rubrics? Because at least you should know the rubrics what exist before you take into the repetition. So CEANOTHUS have these rubrics. As we said, leukocytemia. Now, if you see this rubric, there are around 13 remedies. It's not just CEANOTHUS. There are many other remedies also. But leukocytemia splenic, there are only 3 remedies. So leukocytemia splenic means leukocytemia happens. It can happen. Leukocytemia can happen definitely with many other conditions. But if it is splenic origin, then CEANOTHUS comes one of the remedies out of 3 remedies. Ailments from spleen affections. There's a rubric called spleen affection. In some form, spleen got affected, maybe because of disease or something. And after that, this rubric you can do. Dropsy from liver and spleen. So along with, we have heard, earlier we saw that cirrhosis of liver also. There are conditions when liver gets cirrhosis and spleen gets enlarged. So dropsy from liver, or dropsy from spleen, when it is affected, you will have CEANOTHUS on your heart. Boric. Let's see what Boric writes. The generalities is very important. He says the remedy seems to possess a specific relation to spleen. Folks, that we understood. Agu cake of malaria. He just writes agu cake of malaria. We'll understand this agu cake in the next slide. Predominantly a left-sided remedy. Of course, the organ is on the left side, but if you go in other chapters of head, abdomen, menses, you'll find left-sidedness is very predominant. So all the complaints which are aggravated or problem is there is in the left side. Anemic patient where liver and spleens are at fault. So when you get like when you are reading about spleen, sickle cell anemia, hemolytic anemia. So anemia is a very important component because spleen has a lot of role to play with anemias. So anemia, a patient comes with anemia, liver is affected. How can liver be affected? Maybe in the past you'll find many times he gets jaundice, or some other liver affections are there. And you find spleen is also affected at a fault. There's some pain on the left side. There's some enlargement you can see. Chronic bronchitis with profuse secretion. Last time I said about lower, it's not lower respiratory tract, it's bronchitis. Means not a case of pneumonia. The patient will say that I have a lot of allergies, bronchitis symptoms, cough comes up, and with profuse secretion. This you will get in the evolution of disease. Marked blood pressure, reducing the powers. It's a very important remedy. Hypotension, we read that it can cause hypotension. So it is a very important remedy to use it in a blood pressure condition where we have a lot of increase in blood pressure. Active hemostatic, materially reducing the clotting of blood. So where there is a lot of clotting happening, a lot of clotting is happening, petechial is happening, hemorrhages, bruises are happening. Maybe CEANOTHUS can be of a great help as a hemostat to stop the bleeding or the destruction of particles. Agu cake. Now, this is a term which is being used a lot in our maternity. What does it mean? Agu cake simply means enlarged hard spleen of chronic malaria. Means you get a patient where spleen is enlarged, and in the past history, you find out that he suffered malaria many times. It's called agu cake. What is agu called today? This is an old English term. What is agu called today? Today, most people would refer agu as malaria. So agu, nothing, it means malaria. Starting in the 13th century, feverish illnesses were named agu. From sharp fevers, its roots remained. So agu means sharp, basically. So those people before it was termed as malaria, people used to say that it is an agu fever. The word began to refer specifically to malaria, an infectious disease that spread by mosquito of the 14th century. Now let's go and look into the individualizing symptoms. Left-sided remedy. You'll find left-sided affection in many places. So abdomen pain all up on the left side, pain on the left side, unable to lie on the left side. Okay. It's specifically a spleen remedy. So CEANOTHUS is spleen remedy par excellence. Deep-seated pain. You'll have deep-seated pain in the left hypochondriac region, pain and fullness in the left side. So always patient will come and invariably he will talk about some discomfort on the left side, some discomfort on the left side, the pain, mild pain on the left side, or maybe a severe cutting pain on the left side. That could be indication of his pain is being on target. Pain, inflammation, enlargement of spleen, either alone or with other affections. Means either alone or it is other organs are affected. Indicates its use, chilliness, principally down back, shivering, rigors, must sit up over fire. These all malaria symptoms you can see. So malaria symptoms, spleen affected, again you think of CEANOTHUS. Now there's one very good mental concomitant. It said low spirits with splenic affection. Nair writes down sad with spleen affection. Means the patient has the organ disease, okay, spleen is affected with whatever leukemia or any blood disorder or any disease which affects the spleen. But emotionally and mentally, you will find that it is low spirits, means patient is depressed, patient is sad. That. Headache, right side with spleen pain. I have spoken this many times that headaches many times we treat headache, migraines with our totality, but we forget that sometimes it is a reflex symptom. It is a referred symptom, means some organ is affected, like suppose the gallbladder is affected, liver is affected. There could be a reflex symptom on the head pain. So you can keep giving totality remedies, patient gets better transiently, but until the cause of the pain does not get affected, the pain remains. And here you will find out that patient will have right-sided pain. The remedy is left-sided, but patient will have right-sided headache with the spleen always getting affected. So that lady or the gents who is coming to headache, that's why it is crucial to examine the organ and see which organ is at weakest link. Diarrhea and dysentery have been frequently observed in patient taking CEANOTHUS for spleen affection. So diarrhea and dysentery, as we learned from the clinicals also. Now comes to female. So how can you judge this in female? Leukorrhea is there, profuse, thick, yellow, pain on the left side. So lady will come. You might be given taking totality of leukorrhea, color, aggravation, amelioration, character. But when you go deeper and you look at other areas, patient will say, since my leukorrhea started, along with that, doctor, I have got pain on the left hand side. And then you should think of CEANOTHUS. Maybe totality will not work. Archegos cured with it many cases of suppressed menses or leukorrhea in patients from malarial districts. Now, this is so interesting, so interesting. So in malaria districts, a lot of patients who suffered from malaria. Menses were suppressed. There was leukorrhea and there was pain in the left side. Spleen could be one of the very good remedies. Menses too profuse or too early with pain on the left side. Again, similarly as in leukorrhea, same thing as with menses. Even metrorrhagia with spleen pain. Metrorrhagia, like when we are treating metrorrhagia, again we take totality of it, right? But sometimes we are focusing on uterine symptom, but we forget to see at the other areas which other organs are affected. That can be of great help. Cannot lie down for pain on the left side. As we know, this is the left side element. Yeah, this is what I was searching. So heart symptoms, palpitation, dyspnea with enlarged spleen. Patient can come with a lot of palpitation. So if you see there could be referred symptoms, referred organ, but the center is spleen. Patient will talk about some discomfort on the left-hand side. If he says you have to consider CEANOTHUS. Ezio Majumdar cured with CEANOTHUS 6X, a case which has been diagnosed as heart disease. Now, there are many cases about CEANOTHUS which are so good, like especially heart disease. Patient was treating, maybe they felt it is cardiomegaly or some palpitation problem or some functional disease of heart. But when he examined, he found out that the spleen was also enlarged too much. The enlarged spleen was putting a lot of pressure on the heart, and the heart was causing palpitation and dyspnea. Looking at the cause, and then CEANOTHUS was used. There was palpitation and dyspnea. In this case, there was palpitation and dyspnea on exertion. Majumdar found spleen enormously enlarged. So spleen was enlarged, and that was causing pressure on the heart. And people are giving remedies for heart. But the real problem was spleen. So he gave CEANOTHUS, and it relieved the condition. Case of enlarged spleen mistaken for heart disease. Again, we can find this case in Burnett, where case of enlarged spleen mistaken for heart disease. This is the book, Disease of Spleen. Let's read the case. A few years ago, I was attending some of the members of the family of physician in London and at many various visits, I occasionally heard of an invalid daughter of the family suffering from hopelessly incurable disease of heart, for which she was said to be under the West End physician who was thought to devote himself especially to diseases of heart. This is the problem with specialists, they don't look here and there. The heart was said to be enormously enlarged. The patient had to give up, first dancing, then hurrying, and finally she was only allowed to walk very slowly, carefully, lest the hugely enlarged heart should rupture. Several physicians had examined the case and all were agreed as to its cardiac nature. I had never seen a young girl and took no particular interest in frequent narration of her heart troubles. They are common enough. Time went by and the mother used to speak of her poor invalid daughter with increasing despondency, finishing up one day with the remark that the unfortunate girl was no longer allowed even to walk, as doctor considered even that now fraught with danger. Is it not that sad? Yeah, said she. Would you like to see her, doctor? I declined, saying I never cared about seeing other physicians' patients. More time passed. Finally, I was requested to take the case in hand. I demurred at first because such hopeless cases are unsatisfactory as they are painful also. At last, I consented to take over the case and I appointed a time to call and examine the patient. During all my professional life, I have rarely been more taken aback than I was after I had made my examination of the patient. But I found that heart not only enlarged, but the two other abnormals small, and although apparently the cardiac dullness extended to the foot of the left side. But this dullness on percussion was due to the enlarged spleen, which pushed up the diaphragm of the left lung by its bulk. The heart and the spleen gave one continuous dull percussion mode. Patient had made many genuine symptoms of real heart disease: dyspnea, palpitation, inability to lie on the left side, faintness, but these were due to mechanical hindrance to the heart's action produced by spleen bulking upward so much. So I hope you understand. The spleen was enlarged too much and it caused pressure on the diaphragm and pushed upward, and that caused pressure on the heart. So during examination, he found out, and then it's he went ahead and that young girl I met, the young lady I met 3 weeks ago, looking gloomy, as agile as possible. She has done a share of dancing, tennis, etc. for some years. CEANOTHUS americanus cured the enlargement of spleen for most part, though it swelled again 2 or 3 times at some months of interval. Peramphoros, Gonium, Thuja, Barbaris, and the other splenic came into play before patient was really. Looking at the case now, with the advantage of wider experience and more matured views on biopathology, and with patient full 6 years under my observation, I regard the affection as primary cause of leukocytes due to vaccinian extraction. He says the primary disease of leukocytes increasing. He says it was because of the vaccine infection. Spleen being disturbed secondary and then heart. So this patient was given vaccine. Hence you can see Thuja is there. Okay. This lady was given vaccine. After vaccine, spleen was enlarged and then subsequently put pressure on the heart. Hence it is very crucial, my friends, to go back in the evolution of disease. Suppose this patient comes to you with heart trouble. You will take all the present predominant totality. That's okay. You take that, repertorize that, find out a remedy for present state. But you have to go back and see what happened. Before heart disease happened, what are the other symptoms? She might say, I started with the pain on the left hand side. And when you go back even far, then you'll understand that vaccines were given. And that's how your remedies. Then you will get an idea which other remedies I can use in this case. I'm confirmed in this view by the fact that spleen would not leave off swelling up at certain times till I had cured the vaccinosis. He says just giving the spleen remedy wouldn't have cured it because the real cause was vaccinosis. So he gave Thuja. After giving Thuja and then along with that, repeating subsequently with CEANOTHUS at a in a mother tincture form or expotency, help the patient. That prince of splenics, he says, CEANOTHUS americanus, readily cured the splenic engorgement, but did not touch the blood disease which caused it. This is inherent defect of organopathy, that it is not sufficiently radical in its inceptive action, but the life remark applies to every other pathy more or less, because the primordial cause is more or less elusive and generally quite beyond positive science, which only admits of what it knows and will not seek to encompass the unknown by the process of thinking and the reason. So nicely said. Because in the former times, philosophy made science impossible. The votaries of the science now round up on philosophy and share it over a view. He says, don't look at the philosophies, look at the facts, check your facts, right? And now comes the most important slide. He says to trace back the proximate effects to the remote causes is now ridiculed in the medicine. Because mere medicine or mere science is productive of gross mindedness, incapable of following the fine threads of higher perception. So in terms, he says that today people are not looking at the evolution of disease. They're not going back and finding out, tracing out from where the problem started, how the problem started, what was the first symptom, what nuisance patient did, what drugs he took, what vaccines he took, what foreign body went inside, what reactions happened. So hence, evolution of the disease is the crucial term that I understood out of this case and this understanding and this talk, and going and understanding past histories of the diseases, very crucial. So spleen, chronic hypertrophy of spleen, these are symptoms of CEANOTHUS, enormous enlargement of spleen, deep-seated cutting pains, and fullness of region of spleen. So you saw that, right? Even with leukorrhea, menses, heart, wherever you go, you will find some discomfort in the spleen area. Many times we neglect it. Patient is saying, I get pain here, I get pain here, I get pain. You have to examine and see what's happening there. Splenitis, the pain all up the left side. Severe pain in the region of spleen with low spirits. Remember this, the mental component, the concomitant is very crucial. Low spirit, sadness, depressed with the spleen affection. Dull pain in the region of spleen. Good trauma, good for trauma to spleen, enlarged spleen, painful spleen in any blood disease or dying patient. Stitching pain, sharp pain in spleen, large and painful spleen. CEANOTHUS is the most important remedy for spleen. There are some proving symptoms. Frank Stokes to proven took repeated doses of this tincture and both had severe symptoms. What are those symptoms? One had malaria 5 years before, treated with quinine allopathically. The prover suffered more acutely than other, and in the end had to be treated. Okay. So out of them, one had malaria 5 years before, which was treated allopathically. Now this person who had malaria, suffered, his malaria symptoms increased. He got chills. It became so bad that he had to be given another remedy to remove that. And which was the remedy? The remedy was natramine. Natramine put the symptoms to relax his symptoms. The other prover had practically identical symptom but less severe. Why? Why less severe? He also got malarial like fever, chills, but he had less symptoms. Why? Because in his disposition there were no suffering of malaria in the past. The first prover suffered from malaria in the past, hence it got excessively aggravated. And then, of course, when you get a lot of aggravation with some remedy, you can take totality and help them with another remedy. Now, Boger Sanoptiki writes very important complementary drug. If you see, he says natramine is a complementary drug. So CEANOTHUS, when you're using, it could be seen that after that you can use natramine. You can put the patient, or maybe along with that, you can use natramine if the indications are matching. Complementary drugs always work side by side. Last, we'll come to the individualizing symptom. If you can get this, that's good enough. Thirst for water, but it makes him sick. He's very thirsty, but he cannot drink because it makes him sick. He cannot eat pastries. Now, this is very unusual, right? We have got remedies which have got aggravation from pastries, like we have got pulsatilla. We've got so many remedies. Fat aggravates. But nobody says that I cannot eat pastries. You can say, I don't like sweets. I have aversion to sweets. But this patient says, I cannot eat pastries. Means if he eat pastries, it gets aggravated. Pulsatilla will eat pastries. After that, he might get aggravated. But pulsatilla will not say, I cannot eat. It's a very unusual symptom. Wanted to drink water, but it makes him sick. Now, looking at these symptoms, what we understand is there might be craving for water, like thirst is there, but he cannot drink. It gets aggravated. He might like pastries, but he cannot eat it. Worse in cold weather, constant chilliness must set over the fire. Now, why chilliness is there? Because it's a malarial drug. Chilliness down and back, sensitiveness in umbilical region with desire to relax the muscles, the umbilical region. Whole abdomen moves with the beat of heart. Now, this is strange. Urine alkaline increased phosphate, high specific gravity and traces of sugar. So urine can also be affected in this term. And yes, syphilitic complaints, don't forget that. We heard, in the beginning, we learned that syphilis and gonorrhea. So gonorrhea is also syphilitic in a way. So syphilitic components, syphilitic complaints. So we'll have syphilitic manifestations, all the syphilitic symptoms, right aggravation, salivation, and few more of them. Pulse full, very strong, heart's pulsation visible through clothes, means palpitation. So we are studying about spleen, but it has got a lot of effect on the palpitation in the heart. Now you know why, right? Because as it enlarges, it puts pressure on the diaphragm, and then palpitation, the things happen. Heart beats so hard, it shook him over. Heart beats synchronous with the abdomen movement, visible through the clothes, and it is so hard that he can feel it. The clots also, you can understand that palpitation. Chest feels too small for the heart, yes, because it's being compressed, right? So chest feels too small. Now here don't give cactus. We can think of cactus. No cactus. Understand the organ problem. Where is the problem? Palpitation, dyspnea with enlarged. So this is the crucial symptom. So palpitation is there, dyspnea there, and enlarged spleen is there. So you find these components concomitant, you think of CEANOTHUS. Carotid throbbing of neck. Now you understand, right, why throbbing is happening because of the pressure on the heart through the spleen. Awake all night. Why awake all night? Syphilitic patient. So night is always a problem for them. Dreams all night, unusual, like snakes, robbers. Why? Again, syphilitic manifestations. Intermittence with spleen enlargement. This you have understood. Headache right side with spleen, we have talked about this. Head seems to move with every beat of the heart. Now you know why this beating of the heart is so crucial and why this happens. Mental, few of them, low-spirited, fears he will become unfit for work. So he's very depressed. He's not a vibrant and happy-go-lucky and very excited, zealous kind of person like Natsunomika. He's very low-spirited, depressed. He feels I cannot do this. I might not be able to do this, that. And their repertory writes this anxiety work that he will not be able to unfit. Like he's unfit for it. He will keep saying, maybe I'm not able, I'm not capable. I can't do this. I can't do this. Excitement with chilliness. When chilliness comes, he gets very much worked up and excited. And last, most important one is sad in chronic splenitis. So patient is sad, depressed, unfit for work, and you find spleen is being affected. No other remedy than CEANOTHUS can help. To summarize, primary seat of action is spleen. Spleen affection accompanied with other organ involvement and symptoms. Remember this, spleen affection accompanying. It's not just single one. It can have liver affected. It can have heart affected. It can have the uterine region affected. But the primary, the center would be spleen. Acts organopathically, hence you have to give it in a low potency, maybe X potency or mother tensions. Lymphatic constitution fighting infection, and as I said, leukocytes are increased, WBC count, leukocytomia. So WBC counts are high, very chilly, and in past you will always find malaria. It can be seen like that also, that patient who has suffered a lot of malarias, the spleen might get affected if they have a disposition towards it. And remember, complementary is natriuretic. You might see a state of natriuretic coming up. Now you can understand the sadness, the depression. It's also a part of muriaticum. So natriuretic, that's how it comes very close to it. So I'm done with this, and this was a short talk about spleen remedies, CEANOTHUS especially. We talked about the organopathy understanding, and I tried to give you an understanding how you take up a charge of organ and you start studying the drugs in this fashion where you don't miss it. You study from all the levels, from the repertory, the keynotes, pathophysiology, and the cases. The best examples of understanding a drug comes through cases. Go and get all the cases from the old books. And that's how we can get more understanding of the drugs. So here we end this session, and thank you very much for being a patient listener. I'll be coming again with more videos about more remedies and organ remedies and more features about Burnett series. Thank you very much.